The first communication was done by Emmanuel Biver from the group of Geneva and was related to HRPQ-CT. The rationale is, although BMD measured by DXA is obviously a useful tool for predicting the risk of fracture, it is well known in clinical practice that a great number of fractures occur for patients not with osteoporosis on team of BMD assessment but with osteopenia. So HRPQ-CT is a 3D scan that provides images of the tibial radius and also tibia with a high quality, and two kinds of parameters can be measured: structural parameters which characterize trabecular but also cortical bone, and also parameters obtained from finite element analysis which are related to bone strength. Cross-sectional study have shown that postmenopausal women with a past history of fracture but without osteoporosis but with osteopenia in terms of DXA assessment have alteration of microarchitecture measured by HRPQ-CT as compared with postmenopausal women without fracture but also with osteopenia. There are also few longitudinal studies indicating that data obtained from HRPQ-CT are predictive of the occurrence of fracture. It is particularly true for cortical bone and even after adjustment for BMD. The second talk was done by Roland Chapurla from Lyon and was related to circulating bone regulatory protein. The first part of his talk was related to proteins which regulate bone resorption. And several years ago, a study demonstrated that people with a high level of rank ligand are characterized by an increased risk of fractures with an odds ratio about 9, but this finding was not confirmed in more recently published studies. Also, some studies indicating that there is a relationship between OPG and the risk of fracture, and some studies indicating that an increased OPG level is associated with an increased risk of fracture, but other studies conclude the inverse. The second part of his talk was related to proteins which regulate bone formation, and several years ago a study demonstrated a strong association between high level of sclerostin and the risk of fracture with an odds ratio about 8, and also this finding was confirmed in a case control study, but it was not confirmed in the well-known OFF-ESCEO study. Also, several studies indicating some relationship between the level of both periostin and FGF23 but on the risk of fracture, but the data on this issue are very conflicting. Finally, the last communication was related to fall risk assessment. The assessment of the risk of fall is in clinical practice very important, because for non-vertebral fracture, the great majority of this type of fracture occur after falling, and also the risk of falling with aging is dramatically increased. And obviously the concept of falling refers to the concept of sarcopenia, but the problem is that there is no consensus about the definition of sarcopenia. However, despite this limitation, Trombetti and colleagues in Geneva demonstrated that sarcopenia is associated with an increased risk of non-vertebral fracture, and also one of the tests used for predicting the risk of fracture, so-called the time and go test, is associated in one study with a moderate increase of the risk of fracture. But for the group of Geneva, the author indicated that the SPPB, so-called short physical performance battery, and the simplified affinity test are useful tools for predicting the occurrence of fracture.